News update. You know, it's time for the big hard fact, like Chief Godwin's just said. From now until 6, let's dive deep into the biggest issue in Nigeria today. That's coronavirus. Here's today's big hard fact: there is one confirmed case of coronavirus in Nigeria. One. But of course, you already knew that. I only repeated it because in all our preparations and precautions, it is still important that we remind ourselves that so far here in Nigeria, coronavirus is still under control. And also, like I said all of last week, we must be vigilant, but we also must not panic. And we also must not spread false information. All right, so now we're battling coronavirus on our home soil, and we have the public health authorities telling us that nothing has changed fundamentally for you and I. The same guidelines that we were given last week and the week before last are the same guidelines that apply today. We just need to be extra careful. That's all. We just need to be extra vigilant right now because we've confirmed that somebody has brought into the country and that person has had contact with other people. Now, we have on the show with us somebody who knows what it takes to fight the virus. She's a virologist, and her name is Professor Rosemary Aghogho from the Department of Virology at the University of Lagos. Hello, madam. Thank you so much for joining us on Hard Facts.
Okay.
Hello, ma. Thanks for joining us on Hard Facts.
All right. Thank you.
Yes. Now, why is the coronavirus spreading globally in this way? What is different about it, Professor Aghogho? Hello, Professor Aghogho.
Yes, please.
Yes, you're talking to Sandra now. You're live on the show now.
All right. Thank you.
Yes. So why is the coronavirus spreading globally in this way? What is different about it?
Well, this particular virus has a very the rate of transmission is really very high, and it's new, as you know, so it has mutated, and it's something that we're still trying to find out what is the biological characteristics in it that is making it spread really fast. It's something that is under study. However, we are just fortunate that in as much as it causes some mortality, the mortality rate is still lower than SARS. It's about 2.9%. When you compare it with SARS, it was about 10%.
Now, we're getting a lot of conflicting opinions from the experts. Some are saying that this is a very serious disease and we should be very afraid. Others are saying that for most people, this will be nothing more serious than the flu or a cold, and so we should all relax. And you have even others who are saying something in the middle. What do you say?
Well, this virus is about 80% of those who get infected do not present with symptoms. It's only about 20% that come down with severe symptoms. And those who eventually die, most of them, the mortality cases are majorly in the elderly, 60 years and above, and also amongst those who have underlying diseases, conditions like diabetes, high blood pressure, and heart problems. So I don't think it's anything to be afraid of. It's not something like Ebola, whereby the mortality rate is much higher. In as much as it spreads, it's only a few people that develop severe
symptoms,
disease. And then, you see, once we are able to imbibe with the simple hygiene procedures that is everywhere, then we are safe. Hand washing and respiratory hygiene, covering one's nose and mouth when you cough or sneeze, and then also not touching one's eyes and nose and mouth. So once we're able to observe these simple hygienic procedures, then we are safe. So for me, it is still much better than Ebola. still nothing to dread compared to SARS. So that is my own take on that.
We've heard reports that a person with the virus can start infecting others long before they show symptoms. How accurate is that? And what's the mechanism behind it?
That is very true because it's not everyone that exhibits the symptoms. It's just a few people that, you see, once people are infected, an individual is infected, some within 1 to 14 days develop severe syndromes, severe conditions. Some just have mild fever, cough, and it resolves on its own. And some others don't even show any symptom whatsoever. Meanwhile, they are carrying the virus.
And they're infecting other people as well.
And they could be infecting others. The chances is low, but they could be infecting others. The studies are still on to really confirm that.
Okay. Well, now, what's the mechanism behind that? That's what I want to understand. You're the virologist, so, a little lecture.
Yes, that is still under study. We're still trying to investigate why these symptoms do not, these individuals could be transmitting this virus without, because in the case of Ebola, it's those who already have symptoms that could infect others. So, this was only discovered in
December.
So several studies are ongoing to unravel, to answer so many of these questions that you have.
That we have. Some observers have criticized the WHO for not declaring this coronavirus outbreak a pandemic yet. Do you agree or disagree with the WHO's decision?
Well, for me, I know that WHO is working with many countries to ensure that they are prepared. They are providing adequate information. If you go online, there's a lot WHO is providing. Well, I don't know if they declare that, what additional thing that will, I don't know how else it will help. They are providing all the technical support, the kits that is being used by the NCDC is provided by them. There's a lot they are doing already, so I don't know what difference that would make.
There have been unconfirmed reports that the strain of the virus in Italy has higher infection rates but lower death rates. How likely is it that this virus is already mutating significantly? And what would that mean for the efforts to fight it, Professor Aghogho?
Oh, thank you so much. But the information available to us is that the virus has not mutated.
Okay.
It's still the same strain from the Wuhan. The Wuhan strain is still the same one that is circulating.
Okay.
So there's no backing to that scientifically.
Now, what's your overall assessment of Nigeria's battle to contain COVID-19?
Well, on paper, I think we're doing well. However, for this particular Italian to have escaped from the airport gives me some concern. It just means that the screening they are doing at the airport there, they will need to strengthen it because ordinarily, looking at the travel history, knowing that he's coming from a region where this disease has been reported, they should have quarantined him. So I think they need to strengthen it at the airport. But for the laboratory component, I believe that some labs have been strengthened. They can test and characterize the virus. And we already have isolation centers, courtesy Lassa fever, and also the mainland hospital here for the tuberculosis, multi-drug tuberculosis. So we already have isolation centers. So for the clinical management, I believe we are on top of it. And for even contact tracing, we also have people on ground who can do that. So every other thing seems to be in place. But I guess at the airport, because those who have come from trips have told us that at the airport, they just tell you, oh, just go home and stay in isolation for 14 days. I don't think people will abide to that. So it's better that they strengthen the quarantine
airport screening
at the airport. Yes.
Now, there's a big difference between containing an outbreak and handling it if it spreads. if COVID-19 spreads in Nigeria the way it has spread in China, Italy, Iran, or Japan, how well do you think our healthcare infrastructure could handle dozens or hundreds or even thousands of COVID-19 cases, Professor Audu?
Well, I don't think we will be able to handle it as well as they are doing it in the developed world.
Okay.
However, I believe with what is going on right now, we should be able to arrest it. And that's why I will keep emphasizing at the airport, they must strengthen it. Otherwise, more people will keep coming in. And in some places, they already have travel restrictions. If somewhere like US, they have travel restrictions, the people don't go to Iran, and then they will not allow foreigners from such places into their country. I don't think it would be bad for us to also put some restrictions with these foreigners coming from places where they have such cases reported.
Now, one final question, and then I'll let you go. We've heard reports from Japan that at least one person who recovered from COVID-19 and was declared free of the virus later tested positive. Is it not very rare to see that, to see viral reinfection?
Well, I will want to question that because currently there is no treatment. There is no drug for this virus yet. There are still about 70 different clinical trials are going on. So I cannot, with confidence, say that somebody was treated and cured and then is now coming positive again. So I don't think it's proven. I don't believe that.
Okay. Professor Rosemary Audu is the head of department at head of virology department at the University of Lagos, and she's here helping us calm down. Professor, thank you so much for talking to us on Hard Facts.
It's a pleasure. Thank you.
All right. The real work is being done by the government. You know, the public health professionals, the medical professionals, they are the real soldiers battling coronavirus every day. And we've seen in China, in Iran, and other affected countries, the high number of doctors, nurses, and hospital staff getting infected by the coronavirus and even dying. And we've seen top people in the Iranian health ministry getting infected. The deputy health minister was infected by coronavirus. So let's all keep these brave men and women of our health service in our thoughts and in our prayers as they try to keep us all safe, you know, to the best of their abilities. And speaking of keeping them safe, some of our medical personnel are asking governments to arrange for more protective clothing for them. So they're asking for gloves, masks, personal protective gear. And these doctors and nurses have to touch patients, yes? So they have to make sure that their bodies are completely protected. And they're saying that they don't have enough gear in all the hospitals yet. And this is actually a worldwide complaint. It's not just Nigeria. If you go on Twitter and Facebook right now, you'll see healthcare professionals all over the world asking regular citizens to buy fewer surgical masks and fewer surgical gloves. They're saying if we all keep buying, we're going to create a shortage among those who need them the most, the medical personnel. And if medical personnel are not protected, it makes it harder to stop the virus. And the funniest part about all of this is that the masks are not even protecting you. They're not protecting us much more than every other thing that we are doing. So if you're a medical personnel, give me a call. Throughout the show, I'm going to need you to give me a call. If you are a doctor, you're a nurse, you're a paramedic, you're a public health officer, I want to hear from you. Does your hospital or your office have enough protective gear? What plan is your management making for it? Here in my office, I walked in and the security person handed me hand sanitizer to clean my hands. It's so cool, you know. But, you know, for you who's a medical personnel, what plan is your management making for it? Are you a doctor? Are you a nurse? Are you a paramedic? Are you a public health officer? Does your hospital or your office have enough protective gear? Our number is 01277 0993, 01277 1993, 01277 2993, and 01277 3993. Now, as I've been saying here on Hard Facts every day, This is a battle at different levels, right? So there's screening, there's surveillance, there's detection, there's containment, or quarantine, And these are the things that government has to do relentlessly to stop coronavirus from spreading within the community. Screening is the first level. That's the one that they have to do for people who are coming into the country. The idea is to find out if they have it before letting them in. But screening has its limits. So first of all, there's no way that government can screen everybody coming into the country. There are limited resources. So they have to make choices about which people coming in are most likely to have the virus. So for example, a person coming from Kenya is less likely to have it than somebody who's coming from Italy. But when the government screens the right people, even when that happens, screening is not perfect. The man who brought coronavirus into Nigeria did not have any symptoms when he arrived. It was impossible to know that he was carrying the virus. He only showed symptoms after he was inside the country. And yes, it happens. So the question is, what happens next? Now, the first answer is quarantine, and the government has done that. They've put the man in isolation. He's going to remain there until he hopefully fully recovers and he's no longer contagious. The second thing that happens, the second answer after somebody has passed through screening and wasn't caught by the screening, is surveillance. The government has again snapped into action as far as that is concerned. The federal government and the Lagos state government have said that they are monitoring over 100 people that the man came in contact with, including those who flew with him into Nigeria. We're also getting reports that about 40 persons are being quarantined in Ogun State after also getting close contact with the index case. And if you talk to public health experts and the epidemiologists, they all tell you that this is the best way to handle a situation like this. Basically, when it comes to stopping an outbreak from getting to what they call community spread, Nigeria is doing this by the book. In fact, for now, we seem to be handling this better than other nations, even some who are richer and more sophisticated as far as healthcare is concerned. So you take a look at countries like Italy or Japan or Iran, maybe even the United States. Nigeria seems to be handling this better than they all are. So again, while it is important to be vigilant, it's more important to not panic. And that's what I've been saying for a while now. Let me talk to Olamide, who's calling us. Hello, Olamide.
Hello, good evening.
Good evening.
Though I'm not an health
a medical personnel, okay.
But I just want to chip in few information.
Go ahead.
Concerning the issue at hand. You see, the porosity of our airport is so high, and there is mass carelessness in the part of those officials at the airport. So I can attribute that to because the same issue happened during the case of Ebola.
Okay.
Just we knew that these countries, there are certain countries that needs to be checked when their citizens are coming in, and the same thing is repeating itself. So we need to be proactive, most especially in the coming of anybody from outside. You know, you give too much respect to these white people, and they are bringing in things that are unwanted. That's my take.
All right, Olamide. And Olamide is not alone. You know, that's actually one area where people are questioning the government's judgment. Arrivals from Italy and other badly affected countries. Some Nigerians, like Olamide, are saying that government should have stepped in by now and reduced or banned arrivals from those countries entirely. Of course, government is trying to strike a very difficult balance. You have to understand that. On the one hand, protecting the entire country from coronavirus. On the other hand, protecting the economy from the result of travel restrictions. Every action has its consequences. So every country tries to judge how far it can close itself off during an outbreak without it breaking its economy. But critics are pointing to countries like the US, who have issued travel warnings for Italy, or Saudi Arabia, that has suspended the Hajj to avoid the virus coming in and being spread out. So they point out those cases and they ask, shouldn't Nigeria also be thinking about something along those lines? After all, if the government can close the land borders because surely they can restrict flights from certain countries because of the coronavirus. And that's my next question from you. Do you think that there should be more restrictions? What should those restrictions be, if any? Bear in mind that we have to think about it in terms of government's capacity to enforce. Because beyond this flight restriction issue, how will government enforce it? And also, beyond the restriction issue, how would you rate government's handling of the coronavirus outbreak, both at state and federal level? I want to hear from you. We've got Comrade Adeshino in Okota on the phone. Hello, Comrade. Welcome.
Yeah, thank you, Madam Sandra.
Yes.
Yeah, good evening.
Good evening. Very well.
Well done. What I notice is upon all the efforts of you media, especially Info FM, the effort, all the energy you have been put in place all these days in informing us about this prevention against this diseases.
Mm-hmm.
I notice that people are still don't take it serious.
Okay.
So you can imagine I traveled away from Badore Aja this morning down to Osodi, from Osodi to my two back to Okota.
Okay.
I can tell you that I really see only one person that used a mask tape. I've not seen any downfall or even the government buses. I expect that when I go to government buses from Aja to Osodi today, I will see them with a sanitizer or something given to people before they enter or advising people to protect themselves. But I didn't notice anything of such at all. I've passed over 5 million people today. I've not seen single person.
Well, but the good thing is that I like that you're not seeing anybody wearing masks, because masks don't actually protect you as much as washing your hand will protect you. And if all of us rush and go and buy masks, when the doctors actually need it, they will not see it, which means that they cannot now take care of us if, God forbid, we now fall sick. So it's good. I like this feedback that people are not wearing masks.
People are not wearing
What people should be doing is washing their hands very often. Like every minute, just wash your hand, because you don't know where your hand has been. You don't know where you're touching. Wash your hand with soap all the time. That one is even cheaper than buying hand sanitizer, because hand sanitizer now, small bottle, 8,000.
That's another area we have to talk about. Okay, actually, I try my best, but I expect other people to also to do the same thing. Once I come down from one bus,
wash your hand. Good.
I wash my hand. Look at the nearest fast food. I enter there.
Wash your hand with soap. With soap.
With soap. You understand? So, but I will still use this opportunity to for other people to do the same. And at the same time, I don't know what happened. You can imagine that the hand sanitizer, the one that we normally buy for 250 naira, I bought it at a particular pharmacy center in Badore Road for 1,200.
It's cheap now. Some people are selling 4,000. Some are selling 8,000 for that small bottle.
They told me the big tiger size that we normally buy for 1,000, they said it's 3,000.
Yes.
They have to come down to small one. This small one, my wife is even screaming that what happened from 250 naira to 1,250.
It's demand and supply. It's economics.
That
it happens.
Serious. But people should please. Please. Why do we always make money from people's ethics?
It's human nature. Comrade, thanks for calling me. Let me talk to Ike in Ikeja. Hello, Ike. Hello, Ike. Ike's not there anymore. Seriously, I want to take your thoughts. What's your assessment of how the government has handled this outbreak of coronavirus? You know, how would you rate their handling, both at state and government level, and federal government level? And what do you think about restrictions? Should we ban flights to from other countries, just like Saudi Arabia has done and the US has done? What should these restrictions be? Bear in mind that we have to think about it in terms of government's capacity to enforce it. You're listening to Hard Facts on 99.3 Nigeria Info. It's 27 minutes past 5.
Hard Facts will be right back.
This is Hard Facts.
On Hard Facts today, we're having a conversation about the coronavirus in Nigeria. Today's big hard fact is that there is one confirmed case of coronavirus in Nigeria. You already know that. I'm repeating that because even though we are preparing, even though we are taking precautions, we still need to remind ourselves that so far in Nigeria, coronavirus is still under control. And so, like I said, all of last week, we must be vigilant, but we must also not panic. And we should do our best to not share false information. Now, I talked about one area where people are questioning the government's judgment: arrivals from Italy and other particularly affected countries, badly affected countries. Now, I told you that this battle to fight corona happens at different levels. There's screening, there's surveillance, there's detection, and there's quarantine, right? Now, government has done its best to screen. It's done its best to surveil. It's also done its best to contain. Now, screening is the first level. That's for people coming into the country. The idea is to find out if people have this virus before letting them into the country. But screening has its limits. You heard me talk to Professor Aghogho, and she said some people have this disease and they have no symptoms whatever, but they may be infecting other people. So there's no way for government to screen everybody. Government has to prioritize. And even when they're trying to screen, if a person doesn't have any symptoms, it is impossible to know that that person is carrying the virus. Now, what happens after a person comes into the country carrying the virus? They have to quarantine that person, and government has done that. They've put the man in isolation. He's going to remain there until hopefully he gets better. Second thing that government has to do is surveil. Right? Surveillance. And the government has snapped into action there. The federal government and Lagos state government have said that they're monitoring over 100 people that the man came in contact with, including those who flew with him into Nigeria. We're also getting reports that people in Ogun State have been quarantined as well. And if you talk to public health experts, they tell you that this is the best way to handle things before it spreads. And Nigeria, compared with other countries, is actually doing really great. And I'm talking about countries with very sophisticated healthcare systems, countries like Italy, like Japan, like Iran, and even possibly the United States. Now, the one area where people have complained, and one of my callers who called in mentioned it, which is why I remembered to mention it, is the government's judgment. Arrivals from Italy and badly affected countries. Some Nigerians are saying that government should have stepped in and reduced or banned arrivals from those countries entirely. Now, government is trying to strike a balance between protecting the entire country from coronavirus and protecting the economy from the result of travel restrictions. Every action has its consequence. So every country tries to judge how far it can close itself off during an outbreak without breaking its economy. But you have some people, some critics who have said that countries like the US, who have issues with travel, who have issued travel warnings for Italy or Saudi Arabia, countries like Italy or Saudi Arabia that has suspended the Hajj, do not have two heads, basically, right? These countries are basically trying to stop the virus from coming in or being spread out. Right? And they point to these cases and they ask, shouldn't Nigeria also be thinking about something along those lines? After all, if the government can close land borders because of rice, surely they can restrict flights from certain countries. Professor Aghogho also alluded to something similar when I asked her what she thought about that. And I wonder what you think about that. Should there be more restrictions, do you think? And what should those restrictions be, if any? Remember, of course, that government has to be able to enforce that. And beyond the flight restriction matter, how would you rate government's handling of the coronavirus outbreak, both at state level and at federal level? I am Sandra Ezekwesili. It's 5:37. Hello.
Hello?
Thanks for calling.
Yeah, Sandra, how are you?
Very well. How are you?
Yeah, my name is Ike. I'm calling from Ikeja.
Go ahead, Ike.
Okay, no, when you said everybody cannot be screened, I don't think that is the truth. Because when you are traveling abroad, they screen everybody. And Senator Borofi said last week when they went to South Africa, the officials came into the plane to screen them before they came down. But when they came back to Nigeria, nobody screened them. Everybody were allowed to come into the country.
Well, Nigeria has limited resources. They have to make choices about which people coming in are most likely to have the virus. So, for example, a person coming from Kenya is less likely to have it than somebody coming from Italy. So there's really no way they can screen everybody.
Okay, again, I have another thing to say.
Okay.
Last weekend, I was in Abuja.
Mm-hmm.
At the airport, I was watching the officials, searching the quarantine people.
Okay.
Do you know when they saw the Chinese nationals, the ones that were slim, they will avoid it, they will not search them. But the ones that are plumpy, they will search. I was laughing at the airport.
I don't understand. I don't understand.
So the slim one, the slim Chinese, when they are coming to the airport, the guy that was searching us will not touch them.
Why? What's the rationale behind that?
The guy was afraid. He was only the people that he was touching.
Wow. So, oh God. Thanks for calling me. Let me talk to Dumebi, who is a pharmacist. Hello, Dumebi.
Yes, good evening.
Good evening.
Yeah, I'm so glad to reach you guys today. All right, yeah, concerning the issues of, I'll give credit to the government.
Okay.
And they've done well.
Okay.
From the quarantining to every step that they have taken to even track down the people that have had contact with this Italian man that brought it to our country. But at the same time, this the Italian guys, the news has come out since before he even came to the country. So I think they were lacking in the airport.
Okay.
You understand? They were lacking in the airport. But we should forge ahead. You understand? Now we are looking at the way so it doesn't go round or doesn't spread, like you said, community spread. All right. So I'm holding down my own community.
Okay.
It is my own little strength.
Okay.
So that we don't get infected one way or the other. Yeah. So we provide little sanitizer if possible.
Please, where's your community? Let me come and get sanitizer. Sanitizer is...
Sure. Well, we are even formulating it now. So because the head of the demand rate, so it's being formulated now. So that everybody can access it. You understand? So that everybody can access it. So
well done.
The hike and everything. So we, the pharmacists, some of us are already doing formulations.
Okay. Well done. You should send me a complimentary tube.
Okay.
Thank you for calling me, Dumebi. Let me talk to Steve in Surulere. Hello, Steve.
Hello, Sandra. Good evening.
Good evening.
Yeah, I'd like to actually commend the government.
Okay.
To be honest with you, the level of attention we've given to this coronavirus outbreak, if we give it to other things, I'm not saying we have done exceptionally well, but the level of attention given to it, if this is how we work, I don't think we will have myriads of problems in
I agree with you.
Sectors,
yeah.
in different sectors of our economy. To be honest with you, we have not, I'm not saying that we have done fantastically well, but the level of attention is commendable. It's commendable. At least we still have one index case up till now, from going to 1 week now. So I think they are doing so well. I think they are doing very well.
Okay.
To be honest with you. So let them keep it up.
All right, keep it up, he says. Thank you, Steve. Hello.
Hello, good afternoon, Sandra. Ezekwesili.
Good afternoon, Emma from Aghogho.
Sandra, you made a very instructive point. And you said the actions and their consequences, right? Yes, for government, they have a thin line to draw. Delicate balance between politics and science. Do you understand? Someone mentioned, let us ban all flights from Italy. It's very easy to call the resolution and say that until you are leading a government. There are diplomatic implications of these things. Do you understand? The economic implications. The other time we tried with US, see what they did. They reciprocated with the travel ban. Do you understand? So it's easy to call the government and criticize them until you understand it works. That's for the government. Politics and science, they have to find a stream line. Then for businesses, they have to balance the line between economics and morality.
Okay.
Do I want to make more money or do I want to be patriotic? Do you understand? Do I just follow pure capitalism or do I want to be Ezekwesili mad? Then for the citizens, we have to find a balance between hygiene and panic.
Okay.
Do you understand? Hygiene and panic. One of the things that is creating this demand for face masks and sanitizers is panic. Do you understand? Panic is driving up sales and they're capitalizing. So on the one hand, when I'm blaming the business people, we are the ones creating a market for it because in economics, supply cannot exist out of demand.
That's right.
Do you understand? So these are the three lines. Again, government should find those lines between politics and science. Businesses should find the line between economics and morality. While we as citizens should find the line between hygiene and panic. Like someone said, our government is doing well. Like a popular group, we are doing well. Let's encourage them. But what you can do is this. You cannot stop people from entering. What they should do at the airport is to get database and debrief them in the event. Monitor them, surveillance, like you mentioned. Intelligence, surveillance, and reconnaissance. This is the job of NSA. You understand? Quietly observe them without making too much noise about it.
Okay.
Let's leave it at that.
All right, MI. Thank you for calling. Always a pleasure to hear from you. Livinus is my last call. He's in Victoria Island. Hello, Livinus.
Hello.
Thanks for calling. Good evening.
Yeah, a lot to say, but I'll try to put it briefly.
Okay.
First of all, about our government, I think it's because this sickness doesn't have boundaries, so everyone is careful.
Abi?
Top officials can be infected, so everyone. So when it touches them, they act quickly.
I
so
see.
That's what I believe.
Okay.
Then, on a second note, there's something that the rest of commentators are not paying attention to.
Okay.
And it's something we know, but I think based on my experience, I'm going to emphasize that. The truth is that most of these kind of infections that you get through droplets, they are common in cold weather, okay, in the winter in Europe and in the rest of the world.
Okay.
So while we are analyzing the efforts of the government, how we have curtailed one case, and we are happy with our efforts, which I commend, I think maybe nature is helping us.
Okay.
Okay. Even in Europe and in those parts of the world where you have winter, by summer, you're going to have a hotter season. So seasonal flu, like in France, where I've stayed for several years, you notice that people get better. The rate of transmission drop radically. So it's possible. It's too early. So we are not concluding. I'm just giving my opinion like every other person.
Okay.
And what I'm saying, I think the health officials are aware.
Okay.
But they are not. We don't want to drop our guard and make a mistake.
Well, there's been a lot of that talk flying around, but it's not. There's not been a lot of research into it yet because there's still a lot about this virus that is unknown, right?
Okay.
But I've heard this opinion that you're sharing. I've heard it. But there's nothing confirmed yet because science hasn't backed it up yet. But so in the meantime,
the other similar viruses, coronavirus, you have 4 strains. So we need to look at how they behave even before this one.
Well,
another similar respiratory infection.
Yeah,
transmitted through droplets.
The scientists are looking into all of those. But in the meantime, let's not share this information.
Exactly.
Yeah, let's not share this because we share this information and people will stop washing their hand. Huh?
Exactly. Somebody said maybe the blacks are immune to it. Those are things we should not.
No, that's inaccurate.
On anything,
yeah, that's inaccurate.
So yes, let's wash our hands.
So everybody wash your hands. Everybody don't touch your face. Everybody try to avoid crowded places. So I know that a lot of church events are about to happen. A lot of church events are currently happening. Those are crowded places. You should consider staying away from those crowded places. Wash your hands as often as possible. As often as possible. If you don't have access to water and and soap, you can actually buy some alcohol, buy some vodka, buy some rubbing alcohol, buy some Aghogho. Don't drink it, just use it to wash your hands. You're going to smell like alcohol, but better to smell like alcohol than to catch coronavirus, eh? Abiodun on Facebook says, can you please tell the store owners and the rest to stop the unnecessary hike to the price of sanitizer? Imagine they asked me to bring hand sanitizer in my children's school and it's nowhere to be found. You can actually make your own. If you go online, search on Google or YouTube, you can actually see tutorials how to make your own sanitizer. And then you can have yours. In my house, we're currently using vodka to wash our hands if we cannot get access to soap and water. But the best way to even do it is soap and water. The cheapest way to be safe is to use soap and water to wash your hand. Now, if we look at the spread of this virus outside Nigeria, worldwide, global outbreaks like this one are really bad news. But the silver lining for us here in Nigeria is because other countries are also battling coronavirus like us. We have a chance to compare ourselves and judge without bias whether we are doing badly or whether we are doing well. So let's start with the country that put Nigeria inside the wahala. Italy. Abi? Italy's case is almost a prayer point now. Do you know that yesterday, the number of cases in Italy increased by 50% in one day? From 1,128 on Saturday to 1,694 on Sunday. Mado! And lots of people are asking why. What is going wrong in Italy? Remember that Nigeria isn't the only country that Italy exported coronavirus to. Italy has infected so many European countries as well. Netherlands, Monaco, Austria, Croatia, Greece, and Switzerland. And not just Europe. The virus went from Italy to Algeria and Brazil. So what's up with Italy? The first problem is that Europe, unlike Africa, has great road and rail networks between countries. They have such magnificent infrastructure. But now, that infrastructure is working against them. So many people have been moving in and out of Italy on high-speed trains and buses and personal cars. And remember that there are no visa requirements because Italy and its neighbors are part of the Schengen zone. But that doesn't tell us why Italy, specifically, is causing all this havoc. But what we seem to be hearing is that Italy didn't have great surveillance in place at the beginning of the outbreak. And so they allowed the virus to spread within the country. And secondly, and interestingly, the experts think it spread in Italy because they banned flights from China. I know! Let me explain. The experts are saying Italy made a mistake by stopping flights from China in January. Because here's what happened. People who needed to get to Italy from China now started going through other countries. So, for example, the person now travels from China to Japan and then to Italy. And because of that, it becomes easier for an airport official in Italy to miss the fact that this person is coming from China. Her mind isn't going to China when the official is checking arrivals from Japan. So maybe she doesn't notice the China airport stamp. Maybe the stamp isn't even on the same page. So according to the experts, a lot of people came into Italy from China in the early days after the ban without being identified and without being put on surveillance. So again, I ask, after hearing how banning flights from China contributed to Italy's high cases of coronavirus, do you still think Nigeria should turn away flights? 01277 0993, 01277 1993, 01277 2993, and 01277 3993. And yes, you can send messages via Facebook and WhatsApp. WhatsApp is 080-959-75805. Facebook is Nigeria Info 99.3. And on WhatsApp, this person says, Sandra, Abuja Airport has equipped and those in charge maintain appropriate measures, including distance, check positions, and documentations for traces in and out. I cannot say the same for Lagos Airport, but in China right now, they're spraying city to city and they're spraying shoes, and it's a whole lot more than just saying that there is no problem. Emmanuel is in Apapa. Hello, Emmanuel.
Hello.
Thanks for calling. Good evening.
Good evening.
Yes, welcome. Go ahead.
I just want to say something. We are only concentrating on airports. What about the seaports? Because I work in the seaports and vessels are coming in from outside the countries.
Okay.
Then nobody is doing anything about the people on board the vessel. Isn't that a risk too?
It is a risk as well. But yeah, actually, that's a good question. I cannot answer for the government, but yeah, that's a very good concern that you've raised, Emmanuel. Thanks for calling, especially because in other countries, we're seeing that Italy is spreading spreading this with the trains. Yeah. On WhatsApp, Prosper Alaba says, I don't like. No. Prosper from Mile 2 says, Sandra, I don't think Nigeria has handled it better. Nigeria has not been able to quarantine all who has come in contact with the Italian. We don't even know how many people he got in contact with. These other countries can track the numbers, but Nigeria cannot. The fact that we cannot track others who the Italian has got with doesn't mean that we have been doing well. It could be more than the one incident we claim to have. Well, the federal and state governments are actually tracking these people. More than 100 people have been tracked down. We've got 40 people at least in quarantine in Ogun State. So I think the government is doing the best that it can. We have another comment on WhatsApp from Kende. Kende says that our leaders don't take measure before it happens. I believe all over the world where we have people coming into our country should have sister agencies which should quarantine all immigrants entering into any flights after landing to our airport. Then government should quarantine them immediately, then release them immediately instead of releasing them into the society. Okay. We've got another message here who says, you don't need to spend so much on hand sanitizers. You can prepare it at home, save your money. And says you can use water if you don't have gel. And says ethanol, by the way, is your Aghogho. Okay. Thank you for sending that message across. Abbas did not send a message in. Let me talk to Moses. Moses is in Egbeda. Hello, Moses.
Yeah, good evening.
Good evening.
Yeah, I want to know, in this case of now, isn't insecticide also a way of spraying the environment, fumigation? Will it not kill such virus?
No, because insecticides and fumigation are killing things that crawl and things that walk. This is a virus. So an insecticide will not be able to kill a virus.
Because if hand sanitizer can do it, I thought maybe putting Dettol and using Hypo to wash our clothes to sanitize the house for help.
Well, yeah, there's really no harm in keeping the house clean. Making sure the surfaces are clean with disinfectants and with bleach. That's a great idea. But that's just so that if you've carried anything and put on a surface, you clean it away with the disinfectants and the bleach, because the virus doesn't survive that long outside a human carrier. Right?
Yeah.
So that's just for cleaning surfaces, so that if the surface is clean, when you touch it with your hands and you touch your face with your hands, at least you're not infecting yourself because you've touched a surface that may be infected.
Okay.
Yeah, but insecticides and fumigation, they don't do that much. But disinfectants and bleach for cleaning surfaces, that's actually a good idea.
All right.
All right. Thanks for calling me. Hello. Hello. Good evening.
Good evening.
Good evening. Welcome.
Yeah, thank you. I'm calling you from Aghogho.
Ngozi, do you think that we should restrict flights from affected countries?
Before now, I actually thought of that.
Okay.
But during the course of following documentaries on this virus, I discovered the main thing is not even a flight restriction. There is just, all we need is just to be more vigilant, do the necessary things and put precautionary measures around. It's also a bit, in this case in particular, I will not even blame government in a way, because you may even have your temperature monitors there at the airport. Someone with the virus can actually pass that test and pass. Without even getting a higher temperature and all that. We all know the mode of transmission of the virus in question. It's not like Ebola. Somebody may be having it without even showing any symptoms, and the person is already busy distributing it around. So these are some of the things I think is just taking necessary precautionary measures. Try to go through the passports, people coming from these places. If you feel any person is coming from all these countries, you try to keep in check and watch. I think that should be the major thing to do. Because there is even many other ways of transmission of this thing among us in our communities. Sometimes it's a thing that people really, even during the Ebola crisis. I entered the banking hall then. I see how people just walk into the bank without biros. And you see right inside the banking hall, people are begging for pen. And the same pen, you see somebody chewing the biro in the mouth. The next thing, they pass from hand A to B to C. Honestly, I keep observing this thing each time. I'm telling you, after that Ebola, if I enter bank and you ask me for pen, I would politely tell you, no, I don't share biros. Because there are even many other things you can get aside this, honestly speaking. So I don't know. We have to learn as a people. I don't know, after the Ebola, everybody, we are free and we went back to our former ways. Had it been we continued from the hand washing and cleaning, it would be, by now this thing would have been like a part of the daily routine for us.
Yes, indeed.
Coming for the hand sanitizers. A lot of people are also making a lot of mistakes. Buying alcohol, pouring on children and all that. You know, these things are volatile.
Wow.
It's not something you just buy and you start pouring. And the another funny thing is that every alcohol you use for this have a certain percentage of alcohol that would do the work, especially when it comes to viral infection. So people are just mixing. If you want to do, go log on to WHO website. I think they have some certain standard and method they lay down there. So you can use what you have there to put up whatever if you are not a professional. If not, you go out, look out for sanitizers. Me, I ordered for raw material this morning to make a hand sanitizer because I formulate.
Okay.
Unfortunately, the whole thing has gone up.
Yes, sir.
Times 5 of what I used to buy it before now. I'm telling you, so I don't know what is going on.
It will go back down by the time we get rid of Corona. The prices will go back down. It's the way that economics works. Yeah, demand and supply. Thank you so much for being a part of this show. Like Ngozi said, you can actually make these things yourself. Get on WHO's website, get online, get on Google, get on YouTube, and ask them how to make my own sanitizer. And now sanitizers are actually backup for if you don't have easy access to water and soap for washing your hand. But the best way, the cheapest way, is actually running water, soap, wash for 20 seconds thoroughly, wash as many times as possible, and try and stay safe out there. Thank you so much for being a part of today's edition of Hard Facts. I'm so glad to tell you that I'll be back tomorrow at 3:15, so join me when that happens. Coming up is the news, and after that, conversations with Rufai. Lagos, those were Hard Facts. Good night.